Welcome back. The Supreme Court has come down hard on the centre on its vaccine policy. The Supreme Court has asked the centre to submit a detailed report on how the entire population will be inoculated. They want data on rural and urban population, the vaccination that's happened so far. They've also asked the centre to submit a report on the purchase of vaccines so far with dates, Covishield, Covaxin, Sputnik, and orders placed with manufacturers. Other than COVID vaccines, the court has also asked the government to ensure the availability of the mucormycosis drugs, as the rising number of cases of black fungus and drug shortages is a matter of grave concern. Joining me on the broadcast is Supriya Srinath of the Congress Party and Aparajita Sarangi, Member of Parliament and leader of the Bharatiya Janata Party. Aparajita Sarangi, the Supreme Court has found the centre's policy to be prima facie arbitrary and irrational. Ma'am, the opposition was right. The government asking state governments to pay for vaccination of 18 to 44, even the Apex Court finds it arbitrary.
A very good evening to you and Supriya. Now, let me tell you that the matter is sub judice. We have not reached any conclusion. So don't go for any kind of conclusion at this stage. It would be highly premature. While the Apex Court has raised certain questions, I would say that we have answers to all the questions. We have done the entire work very transparently. We have gone very meticulously into the whole matter. The vaccine policy is the outcome of large-scale deliberations with all these stakeholders. The Honorable Prime Minister sat with the Chief Ministers thrice. The Union Health Secretary has sat with his counterparts in the states a couple of times. We have consulted the doctors, we have consulted the scientists, we have consulted all those who are involved. And thereafter,
if you mentioned all of this in Supreme Court and yet the Supreme Court said this, ma'am, it just goes on to show that there is a disconnect in what you say and what the Supreme Court said.
Let me complete. June 30th is the next date, and we have been asked to file an affidavit. In the next 15 days, we are going to file an affidavit. We will be answering all the questions of the Honorable Supreme Court. We want to answer all the questions of the opposition and the Supreme Court.
Okay, so, Supriya Srinath has a couple of questions, but a couple of answers that the opposition also must give Supriya Srinath, because the Supreme Court also said that political parties and leaders have created and states have created confusion. And haven't they? For example, Anand Sharma of the Congress Party saying that states should be allowed to procure vaccines and talk to manufacturers themselves. And when the centre says go ahead, states sing a different tune, ma'am.
I will just put on record the two things that you've already said, what the Supreme Court has said, and a good evening to both you and Aparajita ji. The Supreme Court has very categorically stated that this is an irrational and arbitrary policy. These are very harsh words for an elected government. But why is the court saying so? And I will answer your question on Mr. Sharma. I'm not running away from it. The court is saying so because the court wants to know what percentage of our people have been vaccinated. And truth be told, with 2 doses, only 3.4% of our people have been vaccinated. We cannot hide behind the charade that India has a huge population. Kaise kare? The same population has elected you. You should have prepared for it. You should not have created a state duopoly, not have waited till January 2021 to place the first dose order. Other countries were doing it between May and October. And also, Gaurav, I think it's important to point out here, there's an RTI that has revealed 2 days back that 35,000 crore worth of vaccination fund, only 4,500 crore of that has been used. Why are we not using money upwards of 31,000 crore? And that's a question even the courts have asked. The courts have also asked that please give us a date of orders placed, the quantities procured, and the projected date of supply. And they will have to answer these questions before the court. Why did you have to wait up until April before allowing one foreign vaccine to come in Sputnik? What about the others? Where do you plan to get 200 crore dosages from?
Okay, and the question on Anand Sharma before I come back to Aparajita Sarangi.
I will answer that question. I haven't seen the statement from Anand Sharma, but I can put my hand on my heart and say that Congress CWC passed a resolution and every state wanted flexibility, including the BJP controlled state, the BJP ruled states also wanted flexibility. But nobody said, not a single statement was made. One second, Gaurav, let me finish. Not a single statement was made which said we want to procure the vaccines. It is illogical. It is going to create a monopoly of the
I completely agree with you, and yet it was made, and that is where this confusion is a cause for grave concern. Let me quickly get Aparajita Sarangi to respond to the question you've raised.
Can I just say 10 seconds?
Go on,
just 10 seconds.
Yes.
I am saying it is completely wrong. But even if I were to accept what you said, should the central government have done this? Walked away from a crisis, looked the other way, told states to manage, and states have to compete with each other. How will
Aparajita Sarangi, since you've been an administrator, you've been on both sides of the fence, respond to this. It's the centre's responsibility. The 35,000 crore rupee question is something that even the Supreme Court has asked. How is that money being spent, and why should the centre not pay for 18 to 44, ma'am?
At the outset, I would reiterate that as far as Supreme Court case is concerned, it is sub judice, it is under consideration. Let us not reach any conclusion. Please wait for our affidavit, please wait for our answers, and then you reach conclusion. This is one part. As far as number two part is concerned, let me tell you that the national vaccine policy, as I told, is the outcome of deliberations. The NDA states and the non-NDA states were present. All the chief ministers were duly consulted, and all of them wanted decentralization of the vaccination process. Tikakaran ka vikendrikaran kiya jaye. Everybody
Vikendrikaran even for procurement, decentralization even for procurement, or only for administration of drugs. No. Even to choose who to vaccinate, because Arvind Kejriwal has made that distinction. Yes, we wanted decentralization, but only to administer the vaccines.
No, who said that? Who said
Delhi
that?
Chief Minister Arvind Kejriwal. Ma'am, I'm quoting names.
I am quoting the Chief Minister of Odisha. The Chief Minister of Odisha wrote to the Prime Minister saying that he wanted to purchase vaccines from the open market. The state wanted to procure. And many of the chief ministers also put his line and told the Prime Minister that they wanted to take from the open market, and we did so. What's the problem? And let me tell you, if the center can put 35,000 crore in the state in its budget, why can't the state have their own budgets? After all, health is a state subject. So what's the problem if the states go and buy? See, 50% of the vaccines we are actually paying for. It's absolutely free for the states, 50%. The rest 50%, 25% by the states and 25% by the private entities. That is the whole
Respond, so Supriya Srinath. We've been over this argument before, but is it not a fair argument that the centre is anyway providing free vaccines for this category, 50%. Even 50% free vaccines? So what is wrong if health is a state subject? Procure the remaining 50%.
Absolutely.
Firstly, Gaurav, I want to put one thing on record. Vaccination is not some rocket science that's happening in India. India vaccinates 40 crore pregnant women and children every year. So vaccination is not new to us. We are the vaccine laboratory of the world. The reason why there's so much of hue and cry is because how could we fall short of vaccination? I want to answer both the questions raised, but first the question about why can't states buy and health is a state subject. That's a completely flawed argument, and I will tell you why. Forget about the states having the money. The GST Council has accepted, the finance minister in that interview with the Times of India has accepted on record that she has not paid last year's dues of the GST. The states have no money, and it's not just the Congress ruled states that are saying so. Even the BJP ruled states like Goa are saying we have no money, we cannot manage. Yes. Please give us our dues. That's the first point. The second point I want to make is give me one statement, show me one statement of a chief minister who has said I want to procure vaccination on my own. And if I were to believe Ms. Sarangi that Naveen Babu said that in Odisha, should all other chief ministers be made to pay a price for what he wrote? Should all chief ministers be left in a lurch? Should people of this country be left in a lurch? Should the youth between 18 to 44 be left in a lurch?
Aparajita Sarangi,
immoral
quickly,
argument is that?
Quickly, because there is 35,000 crore available in your kitty and it is for vaccines. So why not use it when the country needs it?
50%. I'm telling you, 50% is going to the states free of cost. and 35,000 crore will be spent on that and other things pertaining to COVID strategy. This is one part. And number two, let me tell you that these states are supposed to put in their funds. It should be part of their budget too. We are talking of cooperative federalism. It is all about partnership. It's all about collaboration.
Okay.
We are all friends. So when we are friends, when we are in a federal structure, it should be partnership between the center and the states.
There's an allegation that the center has also leveled, Supriya Srinath, if I may, that opposition states are wasting vaccines. Rajasthan, according to the Union Health Minister, being case in point, where Dr. Harshvardhan wrote to the state health minister saying check vaccine wastage. You have Hardeep Puri who's saying 11.5 lakh doses have been wasted, ma'am.
No, Hardeep Puri can say what he wants to. He's an extremely ill-mannered man to be to be a minister in the government of India. I will only give you details of Chhattisgarh and Jharkhand, and they have both clarified
and
that
Rajasthan.
There is 0.6%. Yes, I will come to Rajasthan in a separate question right now. 0.6% being wasted in Chhattisgarh and only 3% being wasted in Jharkhand. The national average is 6%. The government of India says 10%. Please understand one thing. As far as Rajasthan is concerned,
if I may, just on a question of fact, the Union Health Minister has said 1% is the national average of wastage, but that's the Union Health Minister in a letter to the Rajasthan Health Minister. I'm just quoting from that letter, but go on, ma'am.
Yes. The Union Health Minister can write whatever letter he wants under his letterhead, whether he wants to write the right facts or not. The ICMR and the Government of India, Ministry of Health and Family Welfare, their official data, please go to their website, very categorically states 6% is the national average that is being wasted. Having said that, not a single dose should be wasted. What has Mr. Raghu Sharma clarified, the Rajasthan Health Minister, that no, these dosages were not wasted. These were vials that are, because biohazard vials have to be disposed of in a certain way.
Okay.
Let us not spread misinformation. We spread misinformation for Chhattisgarh and Jharkhand, and now we're doing the same thing for Rajasthan. Instead, Ms. Sarangi, please release the money that you owe to your states, including the BJP ruled states, so that they can vaccinate. And I also think there is one element of, if I may say, immorality here. And the immoral argument is we are paying for 50%. Are people between the age of 18 to 44, people like me, not citizens of this country? Should we not be being taken care of by the central government? Should we be left at the mercy of the state government? And Gaurav, please understand, states after states have come on record, including the BJP ones, who have said, we have floated tenders. There has been no response from the potential sellers.
Now the matter is in Supreme Court. I've run out of time on this part of the debate, but let's see what the Supreme Court says on this when the centre submits its affidavit. Of course, states have also been asked to submit an affidavit on this. Aparajita Sarangi and Supriya Srinath, for the moment, many thanks for joining me.